And we'd like to thank Dr. Cwanza Pinckney from joining us today. She is a nationally recognized board certified emergency physician, and she's joining us to talk about not only the coronavirus and how it affects our community and pertaining to its health, but also thinking about this from an economic issue. Welcome to the show.
Thank you. Thanks for having me. I appreciate you.
Yeah, I appreciate you. And first of all, we want to say, we hope, that you stay safe and all of your colleagues stay safe. We appreciate the work that you're doing on the line. We also wish, safety and peace and blessings to your family and stuff. Hopefully everybody in your family is safe also.
Well, honestly, it's hitting a little close to home today. So, this touches everyone, not just the public. For us healthcare providers, we're definitely seeing colleagues out on quarantine, family members who are sick. So it is touching everybody for sure.
Well, you did an excellent job in the article that was in the Grio, and you talked about these particular issues of our health. So I want to talk to you about that, Dr. Pinckney. Let's get into the issue of this coronavirus and how it's being perceived in communities of colors and color, and how we should be approaching this situation, because I have a deep concern that we're not taking this as seriously as we should.
Correct. And, that has been a mainstay of a lot of my messaging and wanting to advocate, especially for people of color, because we know, in the past and in the present, that we're often a very marginalized community when it comes to healthcare. And, we can look back to the Tuskegee experiment. And so there's been numerous data to suggest that, African Americans are at greater risk. And what we're seeing right now is if you're in the small percentage of people that we predict will not do well from coronavirus or the disease of COVID-19, that your ability to access healthcare is going to be your determining factor in whether or not your mortality will increase. And so our biggest concern when we're looking at populations that are typically underserved, it's how easy is it for you to get to a doctor, to get assessed properly, and then also to get the type of expert care that you're going to need if you require a ventilator or advanced treatment support to get you through a COVID-19 pneumonia.
Well, just talking to you from the community in Brooklyn, there were 3 hospitals maybe 20 years ago that was in this particular area. 2 of those hospitals have closed, and so we have one main center here. And so what I was trying to impart to individuals that are out here is that if we don't do what we need to do to take care of ourselves, that this hospital will be overrun, in the section that we're in. And we cannot have that happen. People have to understand that the resources are already limited in this particular community, and that, when we shouldn't be expecting anybody to come to our rescue, that we have to rescue our own self. We have to save our own Black lives. And part of that is educating ourselves about what this disease is, how it affects our body. In the article, you talked about how we need to be able to relax and to stay calm, that we shouldn't allow ourselves to join in some of this hysteria that is out there.
Right. And so, one of the biggest things that I try to tell people is, mindfulness goes a long way. And the biggest thing that I want to impress upon people of color or people who don't have a lot of access is to, one, if you have a family member or a loved one who is sick or developing symptoms, is to have a plan in place. And so I talk about kind of keeping it real, and that's, looking at the reality of the situation, especially out in New York where you are, where it's, basically overrun. New York has only 100 some hospitals. They have the same amount of beds, the highest number of beds in the country, but it's a smaller number of hospitals for a large area of people, for millions of people. And then when you add on top of that staffing and so on and so forth, numbers get limited. So it's not always just access to the hospital. It's, does this hospital have staff enough to support the patients coming in? So it's very important in terms of communicating with healthcare professionals exactly what's going on. And so I recommend writing that down, being realistic that we know the coronavirus is here. It is present. It is highly transmittable. If you look at the epidemiological data, it's at a level 2 in terms of transmission. And sorry about that. Lost you there. We know that it's greater than a level 2 when we look at our markers to say how transmittable is this illness. So we know that it's highly, highly contagious. And so when you start looking at areas with a high geographic number of people in one area, obviously it's easier to spread. So you got to sort of kind of have a game plan already. Where am I going to go if I were to develop symptoms, fever, dry cough, sore throat, shortness of breath, chest pain? What doctor am I going to call? What telemedicine service do I have access to? Where can I go to get a test? And I would recommend doing that before you even have symptoms. So if you're not sick, this is the time to plan your care so that you're not in a frantic position if you or a loved one were to get sick. And along those same lines, it's very important to be able to communicate effectively with hospital staff, because once you come into the hospital and there's been deemed to either be an exposure through travel, which is, now we're not even really looking at that as heavily. I mean, it helps us. Those are the easy cases. But, since we're seeing community spread in large numbers, especially in a state like New York, having a really detailed history about when your symptoms started, what medical problems do you have? And a question I typically like to ask my patients is, I'll ask what medical problems they have, and they say none. And then I ask them what medicines they're on, and there are medicines for high blood pressure, for their kidneys, for diabetes. And so we have to understand and recognize that if you're taking a medication for something, you're prescribed a medicine for something, that means that you do have a medical problem. And I'm not sure why that is. And for providers, it's important to know that we have to ask those questions in a manner in which it's portable or that people can understand. And I would recommend also keeping a list of your medicines so that you can send that with your loved one, because once they enter the hospital right now, almost every hospital has a no visitor policy. So who's going to advocate on your loved one's behalf or your behalf if you were to get sick or could not make a decision for yourself? All those things are very, very important. So pre-planning so that you don't have to think about that in the midst of an emergency could potentially save your life. And so those are the kind of things that I worry about, especially in our community, is making sure that you have an advocate that has the ability to communicate with a healthcare provider, being able to be assertive enough to ask enough questions, meaning, why is my loved one being admitted? What are they being tested for? Why do they require additional respiratory support? And asking those very pointed questions so you can have a better understanding, because right now hospital staffs are overwhelmed. So your ability to communicate quickly will help you to get some better answers and alleviate stress, because every communication right now is via telephone or through telemedicine or some sort of portal, because no hospital in the country right now is allowing visitors.
One of the things that I want to be able to debunk, and again, this is from all of this nonsense you've been seeing on the internet, and I know you already alluded to it before, that Black people can't get this disease, and I was like, that is foolishness, that is recklessness, that is stupidity.
Yeah, and to be honest, I've had colleagues that are medical professionals ask that, off the record on the low, just chit-chatting amongst friends, like, is it, in the very beginning or onset, when we started seeing cases crop up, that was a pretty number one question. A lot of people asked me that, to be quite honest. And I was like, I don't understand why you would think you couldn't get that, but that's absolutely not true. This is a virus. It's an RNA virus. It doesn't care what color you are. If it is going to get into your respiratory system, it's getting in there, and it doesn't care about what color you are. It doesn't care where you live. It doesn't care, how much money you have. If you come in contact with it and it does get into your respiratory system, into your eyes, into your mouth, you're going to contract the illness. And so that is a total myth. And I want people to get that out of our minds. And, in our community, we have a way of dealing with things because of all the traumas that we've endured throughout history through humor. And I find it funny too. I look at the memes and I laugh my own self. But we got to be careful about what messaging we're sending. And so, I have been happy to see the African-American celebrities who are coming out to say that they tested positive. That way we can it's just more support in a way that's portable and understandable for people, that anyone can contract this illness.